Your iCRco software application is launched up here from the desktop. And iCRco will always launch to the patient information data screen. This screen is divided into two halves. The upper half will track your patients. The bottom half will track your exams. So it is entirely possible that individual patients will or can have multiple exams on their return study, or if they're having multiple exams on the day of the initial study. Your typical workflow will be to create a new patient by entering the last name, first name, ordering doctor, patient identification number if applicable. However, if you do not assign a patient identification number, the iCRco software will assign one for you that is a combination of the patient's last name and sequential numbers. Gender is optional. Birth date is mandatory. The date field will always launch with today's date, but that can be changed to the birth date by simply arrowing left and right through the numbers and changing the data displayed. Study description is free text entry. Institution name can be populated at this point, or it can be populated in the defaults and left there forever. We'll see that shortly. This is the exam date and time. DICOM session number if applicable. Free text for study comments. Free text for visit comments. And then from here, cancel will do exactly what it says it does. Save will take us back to this screen here. Save and view will launch the next screen, which includes the scanner's interface. So from here we will check Save and View. This is referred to as the scanner interface. You will note as I move the mouse around the skeleton man, it is listing anatomies and projections all the way out to lefts and right. Also, you will note that this man has a left side and a right side for the extremities. This accomplishes two objectives. Number one, it lists the name, anatomy, and projection on the image in the patient information overlay, and it assigns a specific processing algorithm to that individual image based upon the anatomy. In other words, we process a chest differently from a skull, differently from an abdomen, differently from a hand. So for this demonstration, we're going to check a PA chest. Note that it says chest posterior anterior here. It confirms the name of our patient here. And we are now ready to load the cassette and scan it after its exposure. So once we've exposed the cassette, loaded it into the CR reader, we will now choose the appropriate size and launch the scan. So what we're seeing here is called the scanner preview window. We actually have the opportunity at this point to view the image in a preview mode, which is the raw image, so it will almost always look a little pale. But it'll let us know, did we choose the right anatomy? Did we get good positioning? Are we in the center of the field? Are we ready to go take our second and third exposures? The finished image will drop right up here in a thumbnail preview screen, and our series, as we collect them, will populate across the top of the field, as in this fashion right here where this one dropped. At this point, we're ready to open this image up by a double click. We can orient the image. We can flip the image, rotate it left and right, hanging it properly for the doctor. And we can adjust the window and level of the image if need be. Talk about that in a few moments. Save and accept the image. Close the door to go back to the thumbnail screen. select DICOM send, select the location the image is going to go to, and send the image. The event log here will give us confirmation that the image send was successful, as well as, going back to the thumbnail, you will note the DS up here next to the image number that will also indicate that the image has been sent. Once we've completed our study, we open the folder to go back to the patient information database, leaving the system ready for the next patient.